예, 물론 저희들은
We are hoping that we have passed the peak. And taking numbers into consideration, we are cautiously expecting we have passed the peak.
많은 감염병 전문가들이
A lot of experts were giving us the warning that South Korea could have more regional spread, and we have been preparing for it. But we had not expected the scope of the spread would be this much. Even though it took us some time to respond, I believe we are able to deal with it with our medical system and testing system and monitoring system in place so that we can respond to a large number of infections.
So if I can ask you about Shincheonji, the religious group at the heart of this crisis. Have all the members of this group in Daegu been tested now?
대구에 있는 사람들
There are about 10,000 members of Shincheonji in Daegu, and almost all of them have been tested. I believe about 200 not tested. Some of those 200 will be tested today.
But for some of the members, they've refused to be tested. I mean, this is putting other people's health in danger. How can you compel them to be tested?
보건당국이 찾아가서 설득을 하고
Government officials sought their consent to be tested, and it is also against the Infectious Disease Act. So, of course, had we been able to test them sooner, it could have been easier for us to deal with it. So that is a disappointing part of it.
Minister, how frustrating is it for you? I mean, you're trying to contain this virus in South Korea, and you have a group who is not being transparent.
정말 그 특정한 그룹이
Without this group, we might have been able to contain and cope in this fight against the virus. But we encountered a very particular and unique religious group, so we are trying to block and contain this infection, and we are hoping to be able to come to see a resolution in a short time.
So Europe and the US are now starting to grapple with the realities of this virus. What lessons can you pass on? What, in hindsight, would you have done differently that you can tell a health minister around the world?
이 바이러스는 감염력이 굉장히 높고
I'd like to say that detecting patients at a very early stage is very important, and we learned the simple lessons by dealing with this virus, that it is very contagious, and once it starts, it spreads very quickly and in very wide areas. Not everybody with the virus needs to be checked into a negative pressure room, and also we learned that maybe the lockdown policy is not very effective, because asymptomatic people can be going around and still not be detected.